Francis.
Hi.
All right.
Alrighty.
We are all in the family today. So this is going to be a fun little topic. Francis, who is our, we gotta show you our cool sculpting expert. So Cool Sculpt, but Frances came to me and she was actually looking to just do some refreshing on her skin. She's got beautiful skin. Oh, look at that smile. She really does. She's obviously super young and doesn't need much. But she, you know, I always ask what the focus is, and on her particular focus, let's look at the mirror together. Monique, do you mind taking her coffee? By the way, Monique, say hi.
Hi, Monique.
She does everything. She runs the whole OR with Alina, and she's going to help do the laser. So tell me once again kind of the areas of focus on a young person like you.
My cheeks. Just acne scars when I was younger.
Uh-huh.
A bunch.
Okay.
Of acne
A little bit of
scars,
acne
and then
scarring.
my under eye wrinkles.
And under eye, okay. Well, she doesn't have wrinkles.
No, she doesn't.
has maybe just a touch of loose skin. And Amanda's doing her film. Do a little quick shout out. Turn around. So she's going to be our patient care coordinator. Monique's my nurse. And then Frances is going to be our lovely patient. So, and do you want to tell us how old you are? Okay, we don't have...
I'm 29.
She's in her 20s. So that's really
Late
super
20s,
young. And, you know, in her 20s, she's different from any of my patients that are more like 60 to 70 that have deeper lines around. And some people have heavy smarker lines, and just like she mentioned, a lot of people will have like, you know, lines around their lower lids, and it's just from movement here in the mouth. They move a lot. And so a lot of times we have to go heavy with the laser. Now she brought up a good point. Acne scarring is almost like a deep line, and so we're going to treat the acne scars or any heavy lines with a deeper setting on the laser. And I use a fractional CO2 laser, which is excellent because you can control 3 different factors: depth, fluence, and power, as far as the quality of skin. And so on her, for example, if we look kind of closely, come on, like right next to me, I mean, in all honesty, she doesn't have barely any lines. But I am going to tighten this up. The skin always moves a little bit more in the lower lid versus her cheek is like perfect right here. So we can see the quality of skin here is just a touch thinner. And again, I would say we don't need to go heavy on her at all and anywhere, but we'll do like a medium depth to kind of, you know, give it a little cinch right there and get that a little taut. But again, she really has no lines, so that's beautiful skin. Her cheek right here is like perfect. And then she's pointing out basically zones of like when she was youthful, and you know, she may have a little bit of acne scarring. So acne scarring can be a little bit tricky because some of them can be a little bit deeper and such, but the whole idea is if we have a line or a rough surface, the laser is going to obliterate that outer layer and peel it off to let the new skin come from underneath. With my fractional CO2 laser, generally it's a one-time treatment, and that's what I plan to do with Frances, is kind of do a, you know, a medium laser here. Everywhere else, like around the nose and forehead, that look really good. Upper cheek, we're going to go fairly light. She has great lips and mouth. Again, a lot of people have little lines here. She doesn't have any. But on the acne scarring, we're going to dial in a little bit deeper to have the laser penetrate and to kind of treat those scarring a little bit more. Sometimes with acne scarring or really heavy lines, we may need to do a second treatment. It's pretty rare, but we always say, you know, if we need to hit again, we'll do that. So that'll be kind of the goal, I think, for you, Frances.
Oh, question.
So we went over the basic plan. You know, I think we're going to hit your goals pretty nicely. What questions do you have for my beautiful nurse, Monique?
All right, Monique.
So we're integrating the pre-op here together.
Will
with
I
the
be able to
team.
go to work the next day?
Well, no.
You can,
You can.
but
You're gonna be red. You're gonna be red, and you're gonna want to apply some ointment on. I would go in like 2 days.
Okay. When do I get to wear makeup?
In about a week or 2.
yeah, a week. So basically what's going to happen, you know, with most of the lasers, even if it's a light laser, the fractional CO2 does go fairly deep that you're going to be peeling.
Mm-hmm.
And the peeling is going to look like a sunburn. And usually the peeling takes anywhere from about 5 to 7 days. And then once you're done peeling, it's going to look like a baby's
Basically
bottom.
what I was telling her is it's going to be like a sunburn, peeling brown skin, and then right at 7 days, it's going to look fairly pink. And then at that point, you can immediately apply skincare, and then we usually send our patients to you or Lisa or Audrey for skincare maintenance, whether that's going to be 3 main things you're going to want to protect with sunscreen, obviously makeup, and moisturizer. And we have all these good products here too. Here's a patient that, again, Frances is super young, but if you kind of see up here, this is an effect of how powerful the laser can be from here to here. And you can see she's about 3 weeks out, 4 weeks out. She's still a little bit pink here, but really has that smooth skin. So different types of skin type. Here's another lady who's got much more, I would say, deeper lines here, but look at her cheeks really kind of thinning out, or removing the fine lines there. And this is more like, again, Frances is much super younger, but she doesn't have a ton of lines, but just looks a little bit rough on the cheeks, and in the mouth. And you can see after a laser, it just kind of really gives that, tone and texture and that glossy look. So that's what I think. Frances is more that style in terms of evening out tone and texture.
I want to be able to not wear makeup to work and not hide my face.
She's got beautiful skin. I'm gonna one more thing that's really, really important, and this is more of a question, not a personal question, but what ethnicity or background are you?
My parents told me I was Italian, but
Okay.
I don't know.
So Italian, that's very important. And the reason why in lasers this is very important is we look at skin type. And skin type is very, very important. Those that are very fair skinned, like Norwegian, European descent, tend to heal and have very low risk, and we can go heavy on burns or on the lasers. Now, if someone is of ethnic descent, and Italian's kind of a middle Fitzpatrick skin, the darker skin patients, which Asian, Hispanic, African American, the darker we are with our skin, we have a much more higher risk of hyperpigmentation. So it'd be really light if I was going to laser myself or Monique. For example, I did it on my mother, and she did experience, it's really hard to keep away from the sun. That's the main thing the first few weeks. If the sun hits that baby soft skin, you can get hyperpigmentation if you have darker skin. Very easy to treat, which we have a peel and bleach cream. I think you're in the middle. You're like right in the middle zone. So we'll look for that. But since I am going heavier on the cheek, keep an eye on that. If we see any browning, we'll get you on a peel and bleach cream right away.
Perfect.
We'll get that all dialed in.
Yay!
Oh, it's a yay.
Yay!
Oh, wow.
Yay!
So we're going to follow Frances's journey.
Yes.
She's been nice enough to let us do that, and we'll watch her do the laser.